Regenerative medicine at Emory is a new program that's really focused on trying to develop new therapies for cardiovascular disease. We're trying to go beyond traditional drug therapies and novel approaches where we'll use the body's own repair system to help repair itself. So one of our primary approaches is to harness your own repair system. So in your body right now, you have cells that repair your blood vessels in your heart. They don't do a very good job of it. And that's what we're trying to do, is to harness the stem cells that are in your body, the ones that are normally there in your bone marrow and in your heart tissue and in your fat tissue, and take those cells and help your body to repair itself. I mean, cardiovascular disease now we treat with drugs, we treat with preventive therapies, and those are effective. The next horizon in therapy for cardiovascular disease is really to repair and replace the diseased tissues, and that's the goal of regenerative medicine. In order for us to be successful with our regenerative medicine program, it's really going to require multiple approaches to this problem. And that's one of the really unique features of our group, is we have investigators taking different strategies around this problem. We have investigators working to harvest cells from your body and modify them and give them back. We have others working on vehicles for delivery. We have others working on pharmacologic approaches to mobilize stem cells. And it's really only if we can take this multifaceted approach that we could move this forward and really figure out the best way, because there's not clear what the best answer is.
My research has focused on three areas overall. One is generation of stem and progenitor cells, and the second one is differentiation of these stem cells into cardiomyocytes and endothelial cells, vascular lineage cells. Cardiomyocytes mean contractile heart cells, vascular cells meaning vessel covering cells. So these two cells are needed for treating cardiac and vascular disease, and also we use this for treatment of, as I mentioned, heart and vascular disease. And we also incorporate tissue engineering technology to improve the effects of these stem or progenitor cells. What is the long-term benefits? And there are three ways this research can help. One is, of course, medical and public health aspect, so that we can help patients come back to society with less symptoms and with improved quality of life. And second is, actually, this helps also advancement of sciences. This regenerative therapy incorporates not only biology and medicine, but also engineering technology. So it has a broad impact, broad and deep impact on the science and the society. So this is a new development in biomedical engineering area. And the third one is this also can create a job because this is a new area. We can develop so many new things here, new patents and new discoveries, and then so new therapeutic options. This can create jobs. So it has sort of an industry economic effect. So it has national benefits too.
So some of the work in my lab is working on using different biocompatible materials to support the cells inside the heart. The materials can do a lot of different things, such as protect them from the immune system, protect them from washing out through the normal circulation, and allow them to stay there and do their regenerative work. My short-term goals in my research are to develop technologies to allow stem cells to survive and stay in the heart. A focus of my lab is using special stem cells that can modulate or change the body's inflammatory response. For instance, when you have a heart attack and a lot of your cells are damaged, your own immune system actually goes into your heart and causes more damage. We use special stem cells that actually can decrease the amount of inflammation that happens after a heart attack. And using our biomaterials, we can support those cells in the days and weeks that they're needed in the heart to have their beneficial effect. Of course, my long-term goal would be to be able to use these therapies to help my patients in the hospital. For instance, I was working last week in the hospital and I saw several patients with horrible heart failure that really was completely debilitating. These people had been on all of the best therapies that we have to offer, including medications, procedures, devices. And because heart failure and cardiovascular disease is the leading cause of morbidity and mortality in the United States and the world, we would love to be able to present new therapies for these patients.
One of the really important aspects of our program is that we are very fortunate to have good colleagues at Georgia Tech here in Atlanta. And the Emory Georgia Tech Regenerative Engineering and Medicine program is a very important part of this because it brings together the scientists, the clinicians, and the engineers to work collectively on solving this problem, because it really is team science. It requires very different skill sets put together to make this work. If we are successful, the approaches being employed in regenerative medicine will revolutionize the way we take care of patients with heart disease. We will no longer temporize their disease, but we will actually cure their disease and replace their diseased blood vessels and their diseased hearts.